Iron deficiency anemia in pregnancy. My name is Jo Webb and I'm the haematology obstetric nurse specialist at Nottingham University Hospitals. I'd like to talk to you about iron deficiency anemia in pregnancy. What is iron deficiency anemia? Iron deficiency anemia is when the number of red blood cells in your body is low because of too little iron. Red blood cells carry oxygen around your body and pass this through the placenta to your baby too. Iron is one of the main components of the red blood cells, and so when you have too little iron, then your body can't make enough red blood cells. Iron deficiency anemia is the most common type of anemia in pregnancy. Around 1 in 4 women will have iron deficiency anemia in pregnancy. Why is iron deficiency anemia important in pregnancy? Iron is a substance that is essential to make the red blood cells which carry oxygen around the body. In the case of iron deficiency, the reduction in the number of red blood cells has consequences for both you and your baby. One of the first signs of anemia in pregnancy is tiredness. This can be confused with the usual tiredness associated with pregnancy. It's important to tell your midwife if you feel excessively tired, so she can arrange for you to have a blood test to check for anemia. Shortness of breath is another symptom which can be associated with pregnancy but may also be due to anemia. You may also experience irritability, hair loss, feelings of your heart pounding or racing, headache, dizziness or chest pain. Tell your midwife if you have any of these symptoms so that she can arrange a blood test for you. Your baby takes the iron it needs from your blood first, leaving what is left over for you. However, if your iron stores are low, then the baby cannot get enough iron from you and hence may be at risk of having a low birth weight and developmental problems. It's important to improve your anemia before delivery, as this reduces the risk of you having excessive bleeding at delivery and the need for blood transfusion. This is why it's so important to identify and treat iron deficiency anemia in pregnancy. How to identify iron deficiency anemia? Iron deficiency anemia is easily diagnosed with a simple blood test. This can measure the amount of red blood cells in your blood, as well as the iron level called ferritin. You will have your blood tested for this at booking and at 28 weeks and 36 weeks into your pregnancy routinely, but you should be tested at any time during your pregnancy if you experience any of the symptoms of anemia. It's important that anemia in pregnancy is diagnosed as early as possible so that there is the best chance as possible to correct things for you and your baby during your pregnancy and before birth. What causes iron deficiency anemia? There are a few reasons why you might not have enough iron in your blood. There might not be enough iron in your diet. You may have low iron stores before becoming pregnant. This could be due to heavy periods or having had a pregnancy recently. Your gut might not absorb enough iron, or even if you take adequate amount in your diet, for example, if you have inflammatory bowel disease or celiac disease. It is possible for you to have one or more of these reasons at the same time. How to treat iron deficiency anemia? A balanced iron-rich diet is very important to prevent iron deficiency. The most easily absorbed iron is found in red meat, poultry and fish. If you are vegetarian or vegan, options include lentils, fortified cereals and green leafy vegetables like spinach. If you know you're at risk of having low iron, for example, you're a vegan or have a history of heavy periods, talk to your midwife who will be able to arrange more frequent blood tests to monitor your haemoglobin levels. If you're more than 36 weeks pregnant when your anemia is diagnosed, you may be recommended to have an iron injection into a vein in your arm. This works quicker than the tablets and the aim is to correct your anemia before you deliver your baby to try to avoid complications of heavy bleeding and the need for blood transfusion. One of the known rare complications is when the medicine leaks out of the cannula into the tissue and stains the skin brown, which can be permanent. It's important that you alert the midwife as soon as it stings during the infusion. If you're found to have very low iron levels before delivery, you may require blood transfusion as there is not enough time to correct your anemia sufficiently ready for delivery. This is thankfully unusual though. So just to recap, if you have any of the symptoms of anemia we've talked about, contact your midwife straight away to arrange a blood test. How to take iron tablets. Iron tablets are very good at increasing levels of red blood cells in the blood. How well they work depends on how they are taken. To have maximum benefit with least side effects, iron tablets should be taken only once a day or once every other day, or otherwise they won't work properly. The tablets are best taken first thing in the morning on an empty stomach with a drink rich in vitamin C such as orange juice or Ribena, and an hour before food, other drinks or taking other medication. Vitamin C helps absorb the iron from the tablets. Take the iron as soon as you get up, as you will have to wait an hour before you can have breakfast, which can be difficult when you are pregnant, particularly if you're experiencing nausea or vomiting. It is best to avoid tea, coffee and calcium-rich products such as milk and other dairy products around the time you take your iron tablets. This is because these products reduce the ability for iron to be absorbed in the gut. Common side effects of taking iron tablets are feeling sick, bloatedness and constipation. Dark coloured stools is common and not harmful. Side effects of oral iron tablets. If you have side effects on iron, you should tell your GP, who may be able to prescribe you a different type of iron that you feel better taking. Once your haemoglobin level has come up to normal, you usually carry on with your iron tablets for at least 3 months to make sure that your iron stores are topped up. You will be guided by your community midwife or GP on this. If you have any questions about iron deficiency anemia, contact your community midwife or GP, and you can also ask for the information leaflet on anemia to be added to your badge notes to read.